Imagine you are struggling to breathe and rushing to the emergency room. It can feel overwhelming and a little scary to not know what to expect. But understanding the steps doctors take can bring a lot of peace of mind. When you arrive at the emergency room with an asthma attack, the medical team will immediately perform a rapid assessment of your breathing and vital signs, quickly determine the severity of your condition, and begin treatment without delay. Their main goal is to stabilize your breathing and ensure your airways open up as fast as possible. The initial evaluation in the emergency room is crucial because asthma attacks vary greatly in severity and requiring swift, targeted interventions. Doctors need to assess several key indicators to understand how much air is moving through your lungs, how well your body is getting oxygen, and how much effort you are putting into breathing. They are looking for signs like wheezing, difficulty speaking, rapid breathing rate, and oxygen saturation levels. These quick checks help them categorize your attack as mild, moderate, or severe, which directly guides the treatment plan. They might also check for other potential issues that could be mimicking or worsening your asthma symptoms. You can expect the medical team to first check your pulse, blood pressure, and oxygen saturation using a small clip on your finger, which is called a pulse oximeter. They will listen to your lungs with a stethoscope to hear for wheezing, and they might ask about your symptoms and your personal asthma action plan if you have one. Often, they will also measure your peak expiratory flow, or PEF, which is a simple breathing test that shows how fast you can push air out of your lungs. This helps track your progress as treatment begins. A key component of this rapid assessment is differentiating between a typical asthma flare-up and a severe, life-threatening attack, sometimes referred to as status asthmaticus. In these critical cases, doctors are particularly attuned to silent chest, where there is no audible wheezing because air movement is so minimal, indicating extreme airway constriction. Another interesting point is the use of a simple tool called a spacer with your inhaler, which can actually increase the amount of medication that reaches your lungs by more than 5 times compared to using an inhaler alone. This can make a big difference in an emergency. Understanding this systematic approach to emergency room evaluation means you can feel more informed and less anxious if you ever need to seek urgent care for your asthma. Knowing that medical professionals are quickly and thoroughly assessing your breathing, oxygen levels, and response to initial treatments empowers you to be a more engaged participant in your care, ultimately leading to faster relief and a safer recovery.